Yeah. But before we begin today's main topic, I would like to touch briefly on another aspect which is equally important. So, happiness and health. What I strongly believe is whatever our age is, we can be happy and fulfilled. Like Nidhi said just a few minutes ago, age is just a number. That's what I feel. Okay, so we will talk about happiness and health first. Is health and happiness related? Definitely yes. So depends from person to person, of course, it's very subjective. So let's basically discuss what makes you happy. Is it a quiet family dinner? Is it meeting your friends and family? Is it just socializing like on Silver Talkies? Is it going for a jog, a walk, a run, dancing, etc.? You might be wondering, what does this question even mean? Does happiness decline with age? Now, why I ask this question is, I have seen so many people in the society, maybe my family or friend circle, their parents. As we age, I've noticed many people saying things like, oh, sorry, I can't do this. I'm too old for this. Or I can't go out. I'm too old for that. I'm too old to eat this. The list goes on and on. So does this even matter? What is aging? Is it only a number, or should this even be a reason, to stop doing things which the younger generation does? I strongly believe that if you have a healthy body and a healthy mind, you can have a happy life. So no matter the age. So instead of focusing on just the age, which is only a number, instead focus on healthy aging. So this can be easily achieved with good nutrition, physical activity, weight management, and a positive attitude and social connection. So we will be discussing, of course, about good nutrition and physical activity later on in the presentation. I will first start with weight management. Some things about aging, of course, I agree, cannot be changed or reversed, but how you feel about yourself and how you maintain your body definitely can. It's totally in your hands. So instead of totally be focusing on the aspect of healthy aging and not just aging. So are you concerned about your weight? What even is body weight? Body weight is just your body's total mass. So a person can be a healthy weight range, but practice a sedentary lifestyle, which is more common than you think. So a healthy body weight is one that can be maintained without constant dieting and without restricted food intake. So this scale means a lot. Actually, it's not only about numbers. I think you should not go overboard or restrict yourself too much as well. There should be a balance in every aspect of your life. So what is more important than body weight, you may think? Body weight, like I said, is a mass, but this mass is a spectrum of components. So it includes the weights of muscle mass, body fat, bones, organs, water, all of these things. It's just not a number. So you can see this figure here. What does body composition really mean? You can see the figure on the left. Now this person weighs around 140 pounds or 70 kgs, but has 35% of body fat. See the figure on the right. This person has the exact same weight, body weight, but has only 20% of body fat. So given an option, if you did not know the weights of these two people, whom would you pick? Of course, the person on the right. So weight is definitely not the entire story. So should I be concerned about body composition then, is the next question. What even is a healthy body composition, right? So healthy body composition is one which has a lesser amount of body fat percentage and a higher amount of fat-free mass. So according to research, what we have seen is a healthy male only needs up to 12% of stored fat, while a healthy female needs about 15% of stored fat to survive. That's it, nothing more. So a low skeletal muscle mass and a high body fat percentage can increase a patient's risk, of course, to health conditions like cardiovascular disease and even diabetes, which is so common. So by knowing your body composition, you also know whether you have sarcopenia, which gets me to the next topic. What even is sarcopenia? So it is an age-related muscle loss. Muscle shrinks in size and strength. It is very similar to osteoporosis effects on the bones. So wherein the bone density is lost. We will talk about that too after some time. So it contributes to a number of chronic diseases and conditions. This is what happens. So you start losing the muscle mass, the muscle loses strength and function. There is increased risk of falls, disability, mortality, morbidity, and of course, loss of independence, which is, nobody wants that. Everyone wants to be independent no matter their age. You may want to live for 100 years, but still be independent. No one likes to be dependent and have caregivers, right? Are you at risk of developing sarcopenia? We'll come to know. So usually people over the age of 30 begin to lose muscle mass at a rate of 3 to 10% every year. However, this is a very varied range. Usually in a decade, people start losing, they definitely start losing around 3 to 5% at least. So on an average basis, a person who is 70 years old would have lost around 40% of their muscle mass according to this calculation. I hope after this, it's very clear how important it is to know if you have developed sarcopenia, are you on the way to developing sarcopenia? Are your muscles all right? It is definitely not only about body weight. We need to know about all these things as well to live a healthy life. Everyone wants to lead a long and healthy life, is what I've been seeing. No one wants to just live a long life. What is the use if there's no quality of life? Now, I touched on osteoporosis some time back, so we'll talk in detail about bone health as well. Exercise can help you maintain a healthy bone mass level also. So our bones tend to deteriorate as we age, and there is a reduction in new bone formation basically. So this leads to osteoporosis, which can increase the risk of dangerous falls and fractures. Okay, so the risk factors being sedentary life, age, smoking, alcohol consumption, to some extent genetics. How to protect yourself from this? By having an adequate calcium intake, by getting all the good natural sunlight that we have in the morning preferably, vitamin D supplements by consulting your doctor, and doing some weight-bearing exercises. So how can you prevent all this? We have talked about sarcopenia and osteoporosis. Now what to do so that you don't get it? You can start with yearly health screening, maintain a balanced diet, and lead an active lifestyle. We will be touching all these topics, but let's start with how to find out if you have it or not. So diagnosing sarcopenia and osteoporosis. The figure on the left again, this one shows a clinical test, which is to some extent accurate, but I would suggest do not rely only on clinical tests when we have a very good basis to diagnose in a very accurate fashion actually what is your body composition and what is your bone density, which is DXA. This is how we do it at Nura. So this is an operator, this is a machine, this is the person getting the test done. So the person getting the test done just has to lay down on the X-ray table. You can see this arm over here scans the entire body. It is painless, it is very quick, and there are no special preparations required from the patient's part. And that is how it is done. So what is DXA anyways? It is a non-invasive test and it measures the bone mineral density as well and the body composition. So like I mentioned, no special preparations needed, and it is very quick and efficient, and it's very accurate also. You may be thinking about radiation, but the radiation is so low that you might even collect it anyways in the course of the day. This is how our report looks like here. This is a report of a 73-year-old gentleman. He came to us for a full body health screening. So let me break it down for you. To understand better, whatever blue spots that you see, all the blue areas, is all muscle mass. And all the yellow, green, red spots that you see is fat. So ideally, like we have seen earlier, more muscle mass, the better, and less fat, of course, is very good. So you might be wondering, oh, this gentleman here has a perfect body composition, looks all blue, hardly any fat, very healthy. Sorry to burst your bubble. Unfortunately, if you take a closer view, you can see around the upper arms, and the outer aspects of the thighs and even the calf muscles, there is a very evident muscle loss. So he definitely has sarcopenia. As when it comes to fat, it's okay. He has an adequate amount to survive in a with a good quality of life. But the muscle mass here is what concerns me. As you can see, after all the reporting is done, we get a result saying, yes, he does have sarcopenia. Uh, let me give you an example, actually, coming back to this. This is a 73-year-old gentleman. But why we suggest yearly screening is, let me give you an example of a young woman in her late 30s. She came to us. She is a very fit person. She's into fitness and health. She monitors and controls whatever she eats only healthy food. She came to us quite some time back, and after screening, I was actually surprised because she looked so fit. The body composition revealed that she has a lot of fat and hardly any muscle. So whatever body structure she had was purely, most of it was fat. On questioning her even more, I came to know that she controls her diet to such an extent that mentally calculating the calories, I came to know that she used to eat only around 600 to 800 calories per day. Which is of course not sufficient for her body to run in a proper way. So what happens is, if you eat, even if you eat less, the body tends to go into a starvation mode, which causes it to store all the fat rather than burn the fat or build more muscle. None of that happens. You just start accumulating fat over anything else, and over time the weight is perfect. Of course, she was in the perfect weight range. BMI was perfect. We only got to know this because of the body composition scan. So now she knows what to do. So her calorie consumption was so less, and we do come to know the metabolic rate here as well. It depends from person to person. It's entirely different. So for this elderly man is 1023.9 kilocalories per day. So this is what he burns without even doing anything. Mind you, that young lady was working out every single day for an hour or so. So she is going to burn even more calories, and she's not eating at all. So that is actually harmful, which is why I never advise anyone to restrict themselves. Of course, you should eat how much ever you feel like to keep you satisfied for the next 2 to 3 hours. Another example that comes to mind is a young man, actually. He was in his late 20s. So he came to us with a different point of view. So his family, friends, and family doctor, whoever he met in the last few years, used to tell him, it seems that, I think you should start working out more. You should be conscious about what you eat. You should lose weight. But his body composition chart revealed otherwise. He had a lot of muscle and hardly any fat. Very surprising. So definitely, out of this, one conclusion that I can come to is that looks can be very deceptive when it comes to body composition. Coming to bone health. So again, done by DXA scanning. This is the bone density report. You would have seen, noticed many a times that the younger generation or even people under the age group of 50 years old, maybe men or women, if they face minor falls, they get away with minor injuries, maybe scratches. But no, I'm like very rarely do we hear of these people fracturing their hip bone, their thigh bone, their spine, things like that, severe injuries. But when the group of, when the age group crosses more than 50, 55, or in even women's case, post-menopausal age group, and in men more than 50 or 55 years of age, what we tend to notice more is that if you face a minor small fall, you tend to easily fracture your stronger bones like the hip bone, the thigh bone, or maybe face a disc prolapse in the spine, be bedridden for months trying to recover. All this happens only and only because of bone density loss and sarcopenia. So this is the importance of getting to know your bone density and treating it as early as possible. We get to know with this report if you are on the way, on the border of getting starting the bone loss, or is the bone loss already happening, or is it severe? Accordingly, you can get treatment. Actually, you don't even need to wait until you experience, unfortunately, a fall and then get injured. This is how we get the values. It's all very detailed, and it's tested and compared along with an age group and gender specific group and of the same ethnicity, and then we generate the final report. This is how it looks like. Coming to this now, functional capacity according to age. So you may have noticed in early life, the priority is all about growth and development. In the adult life, it's maintaining the highest possible level of function. And in the older age, maintaining independence and preventing disability. That becomes your main priority. I came across this wonderful woman, actually an article. So Miss Berkel, she was born in 1934. She is setting a new European record for the women's 100-meter sprint in a range band. This is in 2014. This is so wonderful to see. I mean, how many of us will actually even think of doing this at her age? Just goes to show that, anything is possible. So the quote is also very apt. You are never too old to set another goal or to dream a new dream. I hope this is very inspiring to everyone. Over to you, Dyson.
Okay. Thank you, Dr. Lathika. So I'm going to continue the presentation. Right. Hi, everyone. My name is Dai. I'm presenting from Japan. My background is a physiotherapist. I worked in the NHS for nearly 10 years, but now I'm back in Japan. And although my role changed from like a clinical physiotherapist to, at the moment, I'm working with more like health policies and working with government projects and working with the local authorities and also corporations and hospitals. But today I'm gonna speak about exercise and nutrition a bit. To continue from Dr. Lakshya's talk. So start with just to see this slides. So the message is primary aging is inevitable, but the secondary aging is not. So what I mean by primary aging is it's most with body's like cells, structures, and biological functions. That's going to deteriorate. That's something all human beings and not human beings, but also like animals and plants. It's inevitable. But secondary aging, which is due to diseases and lifestyle factors, that's something we can prevent. Can you show the chart on the right side? So this is coming from one of the scientific paper. From age is on the horizontal line, and vertical line is a functional capacity. So as we get older, whatever you do, it's gradually our functional capacity is declining. But if you are sedentary, which means that you are doing quite passive lifestyle, your decline is much faster. Whereas if you are active or if you are doing regular exercise, and that's decline is not, although it's happening, but it's much more slower. And also as you, like if you are a trained person and age of 80, which is more or less comparable to somebody who is a sedentary and age of 50 to 55. So that's kind of, we aspire to do. And probably you have heard lots about benefits of exercise, but first let me go through about the risk of sedentary lifestyle. This is, I think, more so in the current COVID pandemic. It's, I think, happening across all ages, but I think it's more so for particularly senior citizens. I think it's more affected because declining functional capacity is quite slow and it's over time. So somebody you don't notice, but it's progress quite steadily. So at some point you find yourself, your quality of life is compromised. This is why it happens. So we do face age-related loss of muscle mass. If you don't act, then you continue to lose your muscle mass, but also it does make you more difficult to do exercise, and you might put more weight on. It kind of causes a vicious cycle. So you lose muscles, but increase your body fat. And then what happens is on the right side in the square, your risk of type 2 disease, diabetes or obesity, hypertension increases. And at the same time, not only for physical side, but also mental and psychological side, and depression research shows it increases. And the risk of falls also increases. And eventually that's will cause to decrease the autonomy. And that's accompanied with a higher healthcare costs, and then, age-related morbidity and sudden cardiac death. So that's probably not many people wants to go for this path. Whereas if you are doing an active lifestyle, and research has demonstrated that will increase health, increase well-being, and increase functional capacity. And that leads to delayed age-related disability and increase quality of life and increase lifespan. So I think this is a path we all aspire to go, but how? Again, research, there have been lots of studies been done on the exercise and effective exercise types. And research demonstrated two types of exercises. One is progressive resisted exercise, and then the other is aerobic exercise. So what is the progressive resisted exercise? And resisted exercise is something you put use some weights. It doesn't matter whether you use like weights like in the photos, or maybe you can use your body weight, or like you can carry groceries. That's also a resisted exercise. It's also have a very important term, progressive. Our body is a huge capacity to accommodate to resistance. So if you do the same resistance over time, our body doesn't get enough stimulus to grow muscles. So you need to increase your resistance gradually. That's what progressive means. So example of progressive resisted exercise would be like carrying groceries or climbing stairs, lifting your body weight. So using your body weight, or using a resistance band, or lifting weights. That's some examples. on the other hand, aerobic exercise is something you do, and that's to increase your heart rate, and maybe increase your sweat. Examples would be brisk walking, jogging, gardening, like mowing or raking, some like a physical type of gardening, and dancing and swimming is are also an aerobic exercise. And research also showed that some recommendations. So for progressive resisted exercise, twice or 3 times per week are recommended, and aim to do 8 to 10 exercise, and that target all the major muscle groups from upper body to the lower body. But particularly, I think it's important to work on your leg muscles called quadriceps, which is on your thigh muscles, because that's really get you up from the chair or get you up and down on stairs. So it's help you to walk around. So this is, I think, particularly important exercise. And in terms of sets and repetitions, research suggests 1 to 2 sets of 8 to 12 repetitions. And the progression can be done, start with no weight, like you can do the exercise in water. That's reduce the weight. And then use body weight, like exercise on the land. You can do some of the exercise I will show you later. And then use light weights, like, if you have like a pet bottle, and then you can put water in, then you can make a kind of handy weights. You can use it. And then like hand weights and elastic bands, dumbbells and weight machines. So that's something you can progress in terms of exercise. The aerobic exercise, there's 2 ways to do it. One is 30 to 6 minutes per day of moderate intensity of aerobic exercise on 5 days per week, or 20 to 30 minutes per day of high intensity aerobic exercise 3 days per week. And there is some guidance on what level of intensity is moderate and what is high. So if you can talk but not able to sing, and that's a kind of a level of moderate intensity. So if you do slow walking, you can still able to talk, able to sing. That's probably not enough to achieve this aerobic exercise. You need to maybe walk a bit faster. And high intensity is you're not able to say more than a couple of words without, for breath. So if you feel you're not able to, continue a sentence, that's perhaps you are going to like a high intensity exercise. So perhaps maybe you'll start jogging, and that's perhaps for some people is high intensity, but it's all kind of subjective and depends on your functional capacity. So you can, make your more body's reactions, make more awareness on your body reactions, and change your intensity accordingly. And I put some kind of a warning, but it is really important. You need to modify exercise according to your health status, because some exercise may not be particularly suitable for some conditions. So if you're concerned, do consult with your GP before you start exercise. But some of the light exercise you can do, but if you thinking about seriously doing exercise, that's probably I would suggest. So before and exercise alone is not enough. Like examples described by Dr. Lathika, if you're not eating well, then your exercise is not effective. And a combination of exercise and nutrition is more effective. So I explained exercise part, and I haven't touched on nutrition, but particularly protein and vitamin D is very important. If you, for example, if you are like weight around 70 kilogram, you need, particularly research shows people age 65 or over need to take around 70 gram of protein per day. So that's what you need to aim for. And you can take proteins from meats and the fish, but also what you can get from beans as well. And for vitamin D, recommendation is 700 to 1000 milligram per day. And you can take vitamin D from like a fish liver or egg yolk. And also sunlight will, we know, increase to produce vitamin D in the body. So before I finish my part, I will show you the 3 easy exercise you can start from today. So first one is exercise called chair squats. So this is the one particularly focused on your thigh muscles. And the thigh muscles is really important, as I said, to get you up from chair. And also walking and going upstairs. So very simple. Find a suitable chair, and depends on your strengths. You can choose either, if you're not so strong, maybe you can start with a relatively high chair. And if you feel you're strong, then you can choose a lower chair. But basically, following the guidelines, you try to do this exercise 1 to 2 sets of 8 to 12 repetitions. And second exercise I'll show you today is stair stepping. So this is more to do with aerobic exercise. So find suitable stairs or steps, or maybe you can use the bottom of the stairs. So you go up 1 step and coming down, and you just repeat this exercise. So this is increase your heart rate and increase your respiratory rate, but also working on your leg muscles as well. And third exercise I'll show you today is overhead lifts. So you can find you don't have to use the weights. Maybe start with just do without the weights. Even your weights of your arms is sometimes good starting point. And you lift your arm up and then down. And if you feel that's too easy, and then perhaps you can grab, as I said, like a water bottle and use other weights, and you can do this 1 to 2 sets of 8 to 12 repetitions. So that's end of my presentation.
The exercise part is good, but isn't diet also important for the protein content or whatever? And as you grow older, it becomes very difficult to digest the protein. You come up with uric acid problems and all that. So how do you deal with that part? Muscle also needs protein for managing.
Good question. Actually, it depends totally on the amount of protein that you take. So usually, even for senior citizens, the safely recommended amount is around 20 to 30 grams of protein per meal. So this amount of protein is easily digested and excreted through out of the kidneys, actually. So even your kidney functions won't be hampered. Of course, we don't suggest additional highly loaded protein supplements and such, but within the 20 to 30 grams of protein, it's okay.
Yes, adding to Dr. Lathika, I think if you take a healthy, balanced diet, I think that will give you enough protein. Like Dr. Lathika suggests, mentions 20 to 30 gram of protein per meal. If you have like a 3 meals, that amounts to 60 to 90. So if your body weight is around 60 kilo to 90 kilo, that's, cover your protein.
Kgs, and my age is 72. At one point of time, I was about 89 or 90. I have active lifestyle. I do about 2 to 3 hours of exercise, which includes walking, jogging, cycling, swimming is available, that also. So is it bad? For example, sometimes people say, don't do it. At times I go out for cycling and it could be 100 kilometers also. So some people, discourage. How about it? I have got my, let me go. I got my scan done for the density. It was about 108% for my age.
Yeah, so I feel actually not to listen much to what other people have to say about your life. If you are very comfortable exercising or you're enjoying it actually, in fact, and not doing it out of, a compulsion that, oh, I really need to do this or else I might get sick or bedridden, then it's okay. Until and unless you are comfortable in doing that kind of exercise or activity, you shouldn't obviously strain your body to such an extent that the next day you're not able to move at all. And this cycle continues, recovery and then straining yourself to that extent. Just be comfortable. And I think for your height and weight, your BMI might be okay. But like I explained throughout the presentation, so like I explained throughout the presentation, to know the exact details, we will need to see your body composition as well. But unlike what other people say, it's all about your comfort, your perseverance, whatever suits you the best.
Thank you very much. I have basically wanted to ask, what do you define as a brisk walk? Because you see, what I do is I walk about 10,000 steps, but my pace is quite leisurely, because I believe that walking is also a social activity. So when you walk, you meet people, you chat with them. So I'm a little confused. Can a leisurely walk done 365 days in a year compared to a brisk walk done thrice a week, would you consider my way of doing as inadequate? That was question number one. And question number two related to that, about 4 days ago, I had met a doctor, and he said that just as you take 3 meals a day, you must also do your exercise and walking thrice a day. Don't kind of cramp it in one particular hour. Like I work out for about 2.5 hours every day, walking, then yoga, and then evening walking again. So as Ashok said, so I don't know, to me, it sounded a good advice that you stagger your exercises just like you stagger the 3 meals. All right, so your view on that, please.
Maybe I can start with your first questions. I think exercise in any form is beneficial, and more so if you are having fun and enjoyment. So it's obviously recommendation is there, but as long as you do your exercise on and I think you're doing enough exercise. So if you do regularly, that's the most important, I think. And then if you can challenge yourself from time to time, then brisk walk is more subjective. So if you combine your enjoyable walk, but maybe at some part you walk slightly quicker, so you feel a bit of out of breath, or you're able to talk, but as I say, you're not able to sing that sort of pace. That's probably give you extra benefits. But even you continue your exercise as you've been doing, I think you're getting lots of benefits, and then I think you feel that way. So do continue.
Very fit people over here at Silver Talkies, I must say.
Yeah. Okay, here is a question from Shanti in the chat box. She asks, are there any exercises for people with osteoporosis that would help them?
Dyson?
Yes, yeah, osteoporosis, once, obviously, most important thing is the prevention of osteoporosis. So from younger age, using body weight exercise will improve your minerals in your body and bones. So that's for things I would suggest. But once you have like a diagnosis for osteoporosis, you probably need to be careful on what sort of exercise you do. I definitely don't recommend to do like a straight into the heavy weights exercise, but you can start with like using your body weight, like walking or like going upstairs. Something like that will improve your bone health as well. And if you feel that comfortable, and you may increase your level of exercise, but start slowly and then build up. That's, I think, the best way to go forward.
Okay, thank you so much. Daya Shankar has a question. He wants to know, what type of protein do you recommend for vegan diet? Lathika-san, would you like to take that?
Yeah. So vegan, if you're following a vegan diet, you don't have to cut down on proteins, of course. India has abundance of lentils, and we get soy protein as well. Anything which is fortified that way. Also, just make sure that you're not taking too much of it. You have to see the recommendations according to your age. So as long as you are within the safety limits, lentils are good. Lentils will never go overboard. So with every meal, you can have like a cup of lentils or sprouts, for that matter. So lentils, sprouts, soy protein as options. Like in the sense soy milk, we get soy yogurt as well. We get fortified coconut yogurt as well. And there is all the different varieties of beans, like broad beans and red beans, which are all very healthy proteins actually. And you can just consciously implement like in every meal. Basically, we tend to forget to add all the food varieties in each meal. We just tend to grab whatever we like at that point. So if you consciously make a habit of including proteins, it is good.
And someone wants to know any exercise, actually both exercise and nutrition, so any exercise or nutrition for a person with thyroid issues.
Yeah, so thyroid issues, basically you might be referring to hypothyroidism, wherein there is some kind of weight gain, as opposed to hyperthyroidism, which usually sees weight loss. What I would suggest is actually, according to various studies, hypothyroidism does lead to weight gain, but the weight gain due to the condition itself is only up to like 5 to 10 kgs and not more than that. So you need to be in that frame of mind and not think that everything is due to hypothyroidism. With the proper treatment, if you're getting a proper treatment for hypothyroidism, most of the body functions are back to normal. And there is no specific exercise or diet for a person with hypothyroidism. I don't even consider it a disease these days. It's that common. People tend to live with it. Some of the people don't even know they have it, which is actually sad. But since you are aware of it, you can continue in your regular normal diet and normal exercises. There are no restrictions whatsoever, actually.
From me, I think maybe you can try, obviously the fatigue and maybe some sort of like a joint pain may be quite common with somebody with hypothyroidism. So make sure you're not overdoing exercise, because once you get fatigued, it's quite difficult to recover. The other thing is maybe you can consider low impact exercise. So like exercising water, which is quite good low impact exercise. And, you might try like a yoga or some sort, also beneficial for you.
Okay.
Yes, whatever you can comfortably do, actually. That is what matters.
Yeah, in fact, there was another question. Shella wanted to know, what about walking in water, or, when you walk in the swimming pool? How about those kind of exercises?
Yes, particularly somebody who has got osteoarthritis in like a knee joints and hip, walking in water will help, because it doesn't, water, if water is nice and warm, that's really reduce your pain, but also water will, reduce your impact in your body weight. So reduce your load, help for your joints, and then you get exercise. So I think if you have access to that sort of place, I would suggest, go for it.
Okay. Geeta wants to know, how many egg yolks can one have per week, as they are not good for cholesterol? Is there any recommended number of egg yolks that one can have per week?
Actually, what I have read is there have been like many articles have come up regarding this. There's always been a bias regarding egg whites or egg yolks, or is both of it, good, or should I skip either? Usually people tend to think egg yolks are bad. But taken in a okay quantity, if you are not going overboard about it, like some people who are into bodybuilding or muscle building in general tend to consume like 6 to 12 eggs in a day. If you're not doing that, actually you don't need to avoid it. It's okay. Your body is designed in such a way that the cholesterol actually assimilates to some extent. Not everything is absorbed like bad cholesterol. If you have like a good amount of HDL or good, which is called good cholesterol, usually it tends to kick out the bad cholesterol on its own. But it depends. If you already have a higher cholesterol level in your blood, then you may tend to cut down a little bit.
So Sharada wants to know, fasting or intermittent diet helps in reducing weight, since it burns our excess fat and gives enough energy. How far is it true? What's your suggestion?
Yeah, so it will lead to weight loss. But then what I have suggested is today, it's not only about weight loss. Intermittent fasting will not help you build muscle on its own. So, and it will definitely burn fat to some extent, but after some point of time, if your body gets used to it, it will start thinking that, oh, now I'm not going to get a meal. Oh, now I'm not going to get the calories that I want to function, to build muscle, or to lose the extra fat. So then it starts converting all of the fat into storage instead of burning it. So I would suggest that although it's good to some extent, it's still, the researchers are still going on. No one knows for sure the long-term benefits or harmful effects of these kind of methods. Whatever you may implement, you want to implement a very sustainable kind of lifestyle, may it be activity or diet in general.
Thank you so much for being here and for taking us through this informative session.